Hello, good afternoon. Actually, it's good. Well, it is good afternoon. My topic for today is the diet intervention in obesity. Obesity is a topic widely circulated in the media, and it is quite important from the standpoint of its effect on health, so that obesity nowadays has become a public health problem. Both obesity and the weight increase are major risk factors in the increase of non-communicable diseases, so that they have direct implications in type 2 diabetes, in high blood pressure, in stroke, infertility, sleep apnea, cancers and hormone disturbances, and osteoarthritis. These conditions increase with the degree of obesity. Obesity causes various physical disabilities and psychological disorders. If initially it was found in highly developed countries, it is more commonly seen in medium or underdeveloped countries, especially in urban areas. Internationally, all-wide obesity has more than doubled since 1980, so that according to WHO in 2008, more than 1.4 billion adults 20 years of age or older were overweight. Of these, over 200 million men and nearly 300 million women were obese. About 65% of the world population lives in countries where overweight and obesity kills more people than underweight. Also, more than 40 million children under the age of 5 were overweight in 2010, according to the same data. In the United States, more than 60% of the adults are overweight, and 32% are obese. In Canada, 36% of adults are overweight, and another 23% are obese. In Europe, the percentages range between 15 to 25% of the adults who are obese, and in Romania, the percentage of obese population is about 19%. Obesity can be prevented by lifestyle changes. It is very important to prevent the gradual increase in weight over time by introducing minimum changes as regards the calorie intake, by decreasing it, and increase in exercise. According to WHO, a BMI greater or equal to 20, greater than 25 is overweight, and the person with a BMI greater than 30 is obese. So that obesity is considered an imbalance between the energy intake and energy output of the body, and it's in direct proportion to the resistance to insulin, increased level of serum triglycerides, increase in LDL cholesterol, and decrease of the HDL the cholesterol levels. Also with increase in waist circumference in males and high blood pressure. Actually, obesity occurs as a result of a combination of varied factors, genetic, environmental and psychological ones. You have here an illustration. People who are normal weight, overweight, with obesity in 1 and the first, second and third degree, with the cardiovascular diseases indicated. There are factors which have a role in obesity. The genetic ones. Regarding the standard of living, large servings that we are used to having, almost sedentary activity, to the effect that whenever it is possible, we'd rather in civilized countries, we'd rather use means of transportation or our own vehicle without thinking to replace this habit with walking, for instance. Another factor which contributes to obesity is eating in front of the computer or the TV, when besides besides eating, you do a second activity, a different activity. Consequently, the higher intake, calorie intake, materializes in the fatty tissues in abdominal areas. There are two types of obesity regarding the area where the fat accumulates. In the abdomen. The apple shape, which has a higher heart risk comparing to the pear-shaped obesity. Usual tests which are done in obesity, which are taken, blood sugar measurements and tolerance, lipids, uric acid, then the level of thyroid hormones. As regards the treatment now, there are certain stages, and the main stage is the change of diet, followed by exercise, change in behavior, drug therapy, and surgery. What is vital is calorie restriction, which is the cornerstone in obesity treatment. The standard recommendations are the figures there: 1,200 to 1,500 calories per day for women and 15 to 18 calories per day for men. Recommendation is that fat calories should be avoided, saturated fats should be avoided in favor of unsaturated fats. It is very important and beneficial to keep a diary as regards the foods that we eat and the intake. Complications of obesity, as I said, cardiovascular disease, stroke, type 2 diabetes, hypertension, dyslipidemia, high cholesterol, sleep disorders, fatty liver, arthritis, gallstones, cancer and depression. As I've already mentioned, this can be avoided by preventing obesity, by reducing the energy intake and increase in the energy expenditure. Lifestyle changes include diet by reducing saturated fat, increase fibers and fruit, and decrease the serving size. Exercise at least 30 minutes per day, moderate intensity, and at the same time behavior management. Self-monitoring is beneficial. Setting realistic goals, easy to reach goals, and stress management, or avoiding stress if possible. Here are certain types of saturated, monounsaturated, and polyunsaturated fats, which are directly involved in cardiovascular diseases. I was saying that there are saturated fat acids and unsaturated fat acids. It is good to have unsaturated fats, which studies have proved to be beneficial, which is very important, and also we should be able to read labels whenever we go shopping. We shouldn't only look at the expiration date, but also at the composition of the foods we are going to buy. We should avoid those foods which contain increased amounts of saturated fats. The American dietary guidelines recommend a limitation of fatty acids, saturated fatty acids and cholesterol. They also recommend avoiding trans fatty acids, also to lower the intake of solid fats and added sugars, and a higher intake of fruit and vegetables. As regards the strategies of changes in the lifestyle, it is important to establish, ever since the beginning, to set up goals for short-term goals. It is important to do enough exercise, that is weekend walk or daily walks, including fruits at every meal, and to monitor the daily food portions, food servings. Self-monitoring means using a food plan or a food log. Whenever we go shopping, it is important that we shouldn't be hungry, and we should go by a list, because otherwise we buy more and more and we would eat more and more. Also, during the meal, we shouldn't do any other activities simultaneously. We shouldn't engage in any other activity. There are some barriers as regards a healthy diet. We need more time to dedicate to healthy foods as regards the market, as regards the way to prepare them. Another obesity-related issue is to increase sleep and rest, to practice a routine of daily exercise. She mentions here daily meditation or yoga. That means daily relaxation. The social support is very important from family and friends and colleagues, if possible. At the same time, it is good to know that in order to reach the goals, in the first stages, the goals should be easy to reach, and they should be constant and consistent in time. As far as wrong habits are concerned, they refer to eating high-fat foods, in saturated fats, fried foods, irregular meals, eating large servings of food, and low exercise, low physical activity. We should change, we should replace the meals, that is, decrease the saturated fats intake, increase the vegetable and fruit intake, and increase the physical activity as well as lowering the serving size. You should not forget that fresh foods are rich in vitamins and they're as good as cereals. We should buy more fresh fruits and fruit and vegetables. These are the barriers and benefits of the healthy foods. We mean here cost feeds, availability, and shelf life. The benefits are the fresh fruits and vegetables, which are fat-free. They provide minerals, fibers, and vitamins. They help with the weight management. They decrease the risk of cardiovascular diseases. Besides the food pyramid, also the My Plate based diet comes more and more into play. We should have fresh fruit and vegetables, half of our plate. Fresh, a quarter should be whole grains, and a quarter should be fish, poultry, lean meat, or nuts. The basis for this food is the exercise, which should be done regularly and on a daily basis. Consequently, using this type of food, the My Plate model, and on a daily plan, helps to control and monitor the energy intake. Consequent to this society development, transport and the process of manufacturing and processing processes of foods, all these are reflected in our lifestyle, and after that we can have its imprint on our health. It is very important for communities, those in the field of nutrition, to support educational programs for population, which should sensitize them and make them operate changes and make decisions as regards healthy foods in obesity prevention. It is important in the end to limit the energy intake from total fats, to increase the consumption of fruit and vegetables, as well as legumes, whole grains, and nuts, to limit the intake of sugars, and to engage in regular exercise, regular physical activity, and to achieve an energy balance and healthy weight. The changes in lifestyle represent the key to success in weight loss and obesity prevention. And eventually, to this question I would add, it is not enough only to eat less, but also eat healthy, to make the healthy choice as regards the foods that we are to eat. So it is up to us what decision we will make. And because I had the chance to say a few words about obesity, I would like to thank the University of Iowa, where I attended nutrition classes over the last semester. My colleagues in Fogarty program, with whom I spent 5 months. And this is a snapshot of the nutrition classes, where besides classes, we had practical activities to prepare the food according to certain recipes adapted to the pathology which was studied during that week. And you can see the teaching aids. It was tasted. Whoever had a presentation should have a practical presentation. This is Professor Linda Seneslar. Thank you for your attention, and I wish you to eat healthily.